Okay, so back pain and lateral stability. So this is a fairly common injury pattern and compensation pattern that I come across. There are a few others as well, but this one's very particular, and it's pretty easy to sort of identify and understand as well. So what will kind of happen with this is generally people will say, oh, you know, I've got one hip tighter than the other, or the glute on one side is a little bit lazy, or in particular if they say something like, oh, it feels like my psoas is really tight but only on one side. So there's a clue there, there's a difference between the two sides. There's obviously the way your body's handling your weight between left and right is going to be different. So if something's clamping on, it's doing too much work, there's going to be reasons behind that. So the number one thing I always check first of all, if they've got a difference between sort of weight being handled on left versus right around the hip, is always look at lateral stability first, because if something here in your core starts to let go for that lateral stability, that work has to go somewhere. And more often than not, your body's very good at kind of using other muscles, almost like as emergency guy wires, to try and nail on some support to the flagpole that is your spine, and it will try and clamp down on muscles around your hip. So there's a few things that we can check to see if that could be the case, and also some ideas for sort of solving that issue going forward. First thing we can check is we actually check and see if there's a deficiency in lateral stability between our two sides. So generally the pattern's going to be on the side that's got the tight hip flex, or a kind of confused hip. Generally the lateral stability on that side is going to be a bit more feeble and weak. So we can test that with a side bridge test. So what we're going to do is come down onto our side. Number one, make sure our ribs are square, so we're not sort of like dangerously sagging to the floor, because that's going to irritate our back. Scissor our legs, the top leg comes in front, and all we've got to do then is just come up and we're just going to hold a side plank or a side bridge position like this. So what we're looking for ideally is we should be able to get sort of 60 seconds or so reasonably comfortably on both sides, but also what we're looking for, if there's more than a sort of a 10-second difference between the two sides, then we know we've got a problem on that side that's got the sort of lower score. And for some people, like, they won't even be able to get into that position, like they'll just be all buckled and twisted and can't get into a nice straight position or feel comfortable. Again, that's a sign our lateral stability is definitely lacking. And if we tighten that up, that's going to give that psoas less reason to be kind of clamped on, and that hip to be, less reason to be clamped on as well. So if we struggle with that, what we can obviously do is we can do sort of, level one side bridges to begin with 10-second holds for reps to start building that up. And then we feel strong enough, then we can go back to that level two. Again, use sort of 10-second holds and that kind of McGill style to start building up that strength, particularly in our obliques. And we should find as we get stronger, that psoas and that hip is less prone to being locked up. We've got more movement because now we've got the correct muscles doing the bulk of that stabilization work around our core. So the thing that we can check, which will kind of follow along with that pattern for lateral stability being an issue, is how tight our quads are, or basically the muscles in front of our thighs. Because generally if this is going on, there's going to be a difference between these two as well. So we get a nice firm foam roller. We come carefully down to all fours and have our leg, we're going to roll on the roller. Weight on our forearms and our other leg, that's sort of knee bent for support. We just have a gentle scour first of all, so up towards the hip, back down towards the knee. And we're looking for a tight spot, or the worst spot we can find if there's a few of them in there. And then very gently, we're just going to try and do some pull throughs like this. So over the course of 2 minutes, these should start to let go a little bit. So once we're in 2 minutes on one side, we come out to all fours. And then we'll go to the other side, exactly the same thing. Gently down to all fours. Carefully come down, weight on forearms and knee. And again, we just have a little scour first of all, see what we find. Once we've got a worse spot, then we're just going to do some pull throughs like this. And what you'll find, if there's an issue with lateral stability, is there'll be a noticeable difference in tightness between the two legs. So one's going to feel noticeably worse than the other. So doing that sort of movement before you do your exercises will help. It'll also help if you're struggling to get your glutes to fire. Getting that tight side to let go a little bit, make it a little bit easier to get your glutes to fire, and that will help as well. But the underlying problem with that compensation, that pattern, is that lateral stability. So long term, the real solution is addressing that deficiency in lateral stability between both sides. Get them as even as possible, and then get them both as strong as you possibly can as well in terms of strength endurance. And that's going to stop the body's need to kind of clamp down around that hip and on that psoas to kind of compensate for that deficiency.